An important part of your practice when you're on your own too is you want to be aware of how you are before you start, be aware of how you are during, and you want to be aware of how you are afterwards. And that awareness actually helps with the process itself. One of the things that's become quite clear in neuroscience is that the way in which you attend to what you're doing determines largely what you will find in the doing. So to give you a practical example of that is that if you work out, but you hate it and you resist it and you piss and moan, it'll actually hurt you more than it helps you, no matter what the exercise is. So there has to be an alignment within yourself when you're doing something. And the way you attend, how you pay attention, and the way in which you pay attention makes a big impact on what you will find and what you're doing. Hi, I'm Michael Westgate. Thank you for joining me. I've helped people with chronic pain for over 2 decades. I aim to help you say goodbye to pain and hello to a fully lived life. So today, now we've done some of this before, but today we're going to do more somatic experience exercises. So somatic actually means of the body. So the practices we're going to be reviewing or practicing today together are from the work of Dr. Peter Levine, who's he's the one that came up with what's called somatic experience therapy. It's actually a method. And one of his colleagues, Dr. Maggie Phillips. Unfortunately, she's passed. Peter is still with us. The question might be, well, how do I apply these practices to my life? So I want to put that in context before we begin. First thing is, you might even do this right now. Identify a pattern in your life that you don't like, something that's detrimental to your overall wellness. Okay, so here's some examples. Maybe you have trouble sleeping, or maybe you react to a family member in a way that you regret afterwards. In the moment it seems justified, but later you're like, why did I do that? Another one might be when you freeze up when it's time for you to speak up for yourself or advocate for yourself in some way. These are all just examples, obviously, but almost everyone has something that they do reflexively that they're not proud of or they don't like, or that somehow is detrimental to their lives. I mean, it could be even more drastic, like some people get upset they drink too much, or they go gamble, or they spend too much. So there's all kinds of potentials. And what I recommend is using these techniques before or after you become activated or triggered by something. And the reason I'm not saying during, because this during is hard. Once your behavioral pattern gets activated, it's really hard to stop it. And down the road, sometimes you're able to, but I think realistically, it's better to try before and after. So therefore, if you see a situation coming, I'm going to go see my mother-in-law and I always get triggered or something like that, then you could make time to do the practices beforehand to hopefully help your system be more resilient when you get into that situation. And then after the situation happens, especially if you've been triggered and you're activated and you're upset, then you could do the sequence, because I'm showing you today as a sequence that would help bring you back to a more regulated place and a place of recovery. And the other thing is, if you practice a lot, it gets easier to use these when you need them, like anything. So you want to practice daily so that when you need it, you can have it in your system already there, and then it can be accessed. The responses we're talking about are habitual, and they're not you can't control them with your conscious mind typically. Willpower usually doesn't work very well, if at all. And the most important part is that whatever that habit is, it actually makes the situation you're in worse, not better. So that's the criterion. Now, the part that we're going to start with is this concept that when we get triggered bad enough, we actually lose touch with our bodies. And the reason we do is because the feelings that come up, the body sensations that come up when we are overwhelmed, are so disagreeable and so distasteful to us that we actually cut ourselves off from our body. And the following exercise can help you reconnect with your body in a way that will bring you back to your better self. And again, like I said, you may be able to stay with yourself more often and be less thrown off. And of course, that's a sign of growth, and that's what we want. And it can be anything from people like to use the word trauma, and I think it's overused now. So I'm just going to say, any pattern that causes you discomfort in some level, which is actually all these things are levels of pain, by the way, that you don't want to repeat. So first we're going to do is to reclaim a connection with our body, learn to befriend it, and to trust it even when it feels bad. And typically, it isn't easy to trust your body when it feels bad. Most of us want to numb it, run away from it, or distract ourselves in some way, rather than be with those overwhelming sensations. So let's start with this one. So this is called pendulation of your body sensations. And the pendulation is, it means to go from one to another, right? So we're this is a rhythm of over here and now over here. So let's start by just settling down and try to kind of feel yourself in your chair, wherever you are. And the first thing I want you to do, and you can close your eyes if you like, you don't have to, but you can close them, is find a place of ease in your body. So you can start, maybe just kind of do they call a body scan. So you're gonna feel your feet and then just kind of sense your body from the feet up. Ankles, knees, thighs, and so on. And what your goal is to find a place in your body that feels at ease. There's no distress there. It's fine. And then once you find a place, I want you to breathe into it, meaning that as you breathe in, you focus more on it. So breathe in, focusing on it. And then as you breathe out, kind of soften your focus so you're not focusing on anything. You're just letting it go. And you breathe in again, focusing on that place, and then breathe out and just let that go, that awareness go. Okay, now I want you to be aware of a place in your body that doesn't feel very good. It's distressed in some way. Could be all kinds of levels of distress, flavors of distress. It could be tightness. It could be numbness or a tingle, or it could actually be a pain. And I don't recommend focusing on the most disturbing part of your body if there is that sort of thing going on, and choose something kind of semi-uncomfortable to start. And so in this case, again, you're going to breathe in and focus on that place specifically, and then breathe out and let it go. So soft focus, not focusing on anything. Breathe in, focused very intently on that spot. Breathe out and letting it go. And then at your own pace, move back and forth between area of ease and an area of distress. And with that same pattern where when you're at whatever place you're focusing on, breathing in means that you're going to be more aware of it and more attentive to it. And breathing out is that you're letting it go, like you're just kind of relaxing everything if you can. And then that pace of going back and forth between distressing and ease and easy and okay. Okay, so now, as you do this, try to be aware of the sensations you're experiencing in your body and do your best to name them. For example, something could be tight or constricted. You could feel tingling, stabbing, aching. These would be the distressing ones. If something is feeling at ease, it might be warm, or it might be kind of at ease or relaxed. You might even feel cold somewhere too. That could be either pleasant or not, depends on the person. Okay, and now, in addition, be aware of how the sensations shift and how your awareness of the different areas deepens as you pendulate back and forth between places of ease and distress. I'm just going to let you do that for a few more minutes before we go on to the next exercise. So just keep up the awareness of the sensations. And remember, when you're focusing on one or the other, either ease or distress, you want breathing in is focused, awareness. Breathing out is letting go. Then you would shift. The other part of the pendulation is shifting to the other area of the stress. And then noticing how things change as you pay attention and shift back and forth. We're going to go for one more minute, and then I will move on to the next. All right, and then gently bring your awareness back to kind of your surroundings, slowly. And one of the things I want you to pay attention to is, how does your body feel now compared to when you started? Typically, people will feel kind of more at ease, generally speaking. All right, so our next exercise is awakening your basic sense of your body. It's called the felt sense. To re-inhabit, to reclaim little by little a connection with yourself. Now, right now, you might not have started out distressed, but just imagine how you would be if you were super upset originally. So you just went through what we did. Now we're going to try to have some more connection with ourselves, even more than we have with the last exercise. And I'm going to give you a number of things to try here. What we're doing is we're going to stimulate the surface of our bodies, or even deeper into the muscle. And what I want you to experiment with is which of these types of sensations your body likes better. So, and it basically what we're doing is, so here's one of the ways is to tap on your body, right? So this is one potential. And what you would do is you tap, both sides of the hand. And then, what you're doing is you're trying to get a sense of being connected to this place in your body, to be a whole person that has, instead of parts, you have awareness of your whole body at once without any feelings of being kind of broken up into pieces, which is what happens when we're upset. We separate from ourselves in certain ways, and we become fragmented in certain ways. So tapping is one. I'm going to run through the options real quick. You don't have to do them all the way through. And what you would do is you're going to tap, up your arm, both sides, right, up to here, and maybe then you can start on your face and head and so on. The other one is to squeeze, right? So you can squeeze yourself like this, right? That's another one. And then you would do the other side when you finish that, and then you can keep going, down the chest and down the sides and into your legs and so on. Another one is to kind of almost like scratch, right? Right? That's another one. And the final one is to almost like caress, like this, right? You're kind of caressing, and it could be slow or it could be quick or whatever works for you. So let's start by just testing out. So remember, we have tap, squeeze, scratch, or stroke or caress, right? Those are our four potentials. So go ahead and I want you to trust your body. So your body's going to tell you what it thinks by its reaction. And this is part of learning how to hear your body's voice, so to speak. It's a silent voice, but it's a voice. And it has an opinion, and it matters what it thinks. So let's try that. So you can maybe start in your left hand, and okay, let's try tapping and say, what does that feel like? What does my body think of that? And maybe it doesn't like that. So what about kind of a scratching? How about squeezing? Squeeze. And if not that, how about kind of more caressing, sort of soothing sort of stroke? Whatever it is that speaks to you. And by the way, if you want to use all four, go ahead. Just explore. And then you can, explore the parts of your body too. Maybe one part likes tapping, another part likes scratching, or another part likes, this, or you want to squeeze. Just try it and see how it feels. Yeah, so and then work your way into your arms, down your chest, and in your sides. And then eventually maybe to your thighs, since you're sitting. If you're so inclined, you can lean forward and do something to your back or your upper back, and as much as you can reach. Depends on how flexible you are. And do your best to kind of cover most of your body. But what you're trying to do is invite your body back to your awareness. You're trying to wake it up, and you're basically saying is, I'm inviting you back to my awareness without resistance or judgment. I'm trying to be in here fully in this body of mine. And notice maybe some areas don't like being touched. And if they don't argue with it. Just leave them be. Others might want more touch. All is fine. There's no right or wrong way. It's your way. Whatever way your body says yes to is the way you want to do it. And if you're someone that has trouble waking up in the morning, this can be a good way to do it. Because often the reason you have trouble waking up is you're somewhat disconnected from yourself from sleep, or from what you were dreaming, or stress that was unprocessed during the night. Okay, so the first set that we did were for re-inhabiting your body after you've abandoned it because of intense sensations that you did not want to feel. Next, what we want to do is establish the flow in your body. And the reason for that is that pain and trauma can't coexist with a sense of flow. Because a sense of flow is an interconnectedness. Right? So we want to kind of encourage that interconnectedness within our bodies. And we're going to go through a number of potential exercises in the flow category. And the thing that these are often really good for is when you feel stuck. You're kind of rigid and unmovable, or you feel frozen, or you have a hard time getting yourself to move forward on something. But again, I do recommend going in the sequence that we're going in. So the first step for this is to find, and this is actually the first step before you do the other ones, is find a resting place in your body. So this is a little different than the pendulation, because we're not going to pendulate. Actually, we're going to try. So I want you to scan your body and find a place that feels not good or bad, but just okay. So it's neutral. So we're looking for a neutral place. If I were you, I'd start with the feet and kind of come up to the calves, and then thighs on both sides, and pelvis, stomach, chest, right? Sides, back, up to the head, down the arms. Okay, so try to find a place that feels steadily okay. It doesn't fluctuate. It's good. And then when you find that place, just rest in it. Be there. try to just focus on that area exclusively and just be there. Next, now that this exercise is often done standing. So, but I want to teach it both ways. I'm going to teach you how to do it sitting, but also you might want to stand up and try it too. And the reason I want to say that is there may be circumstances where you don't have an opportunity to stand, and yet you would like to be more grounded. So this is a grounding exercise. So I want you to feel your feet on the floor. And start by being aware of that place that you found, that resting place. Be with that place first. Okay. Now I want you to put a little bit of weight on one foot. You're going to press down, obviously, if you're sitting. And then, very subtle, by the way, this isn't like pounding at the floor. And then very subtly shift to the left. And then back to the right. And to the left again. And then find your own rhythm. Back and forth. Whatever feels like. And you could even sway your torso a little, because that's going to be, so it might be more so one buttock to the other, but still you're pendulating back and forth. Okay, so you get a sense of that. So now I recommend standing. I'm going to stay seated because it's really hard to see me when I stand with this camera angle. So go ahead and stand. Okay, so now you're standing. So you want to feel your feet on the floor. You want to feel them spreading out with the weight of being standing. And then we're gonna do that same practice where you're going to very subtly shift from one side to the other side. One side to the other side. Kind of like being on a swing, or a seesaw. You just let that rhythm be naturally found within yourself. So I'm not telling you what pace you should go. You're going to find that on your own. You're going to just feel that swaying back and forth. That's great. Back and forth. And now I want you to try something else. How about, what does it feel like to sway, to let your both feet are on the ground solid, right? And we're going to sway slightly forward and slightly backward. And it's going to be, again, that seesaw motion, very subtle, doesn't have to be very dramatic. Back and forth. And what I want you to ask yourself is, how does that feel compared to the side to side? It's not a grade, it's more just an observation. Does that feel more settling? Or is it activating? Or what is it? Whatever it is, just be aware of it. And then let's go back to the side now. So we're going to go, we're going to go side to side, feeling the weight in each foot, all the way up your leg into your hips, and just what does that feel like? Back and forth. Nice and it's steady. There we go. Very nice. Excellent. Okay, so next, go ahead and sit again. And now what we're going to do is a technique called circle breathing. Maybe if you've done yoga nidra before, you may be aware of this. It's not a very common practice in my experience, but it's very helpful. So we're going to do a number of different versions of circle breathing. So this one is I call foot to foot. So what you're going to do first is you're going to scan both sides of your body. So left and right. And you're going to say, okay, left side of the body, right side of the body. Which one feels more at ease than the other? Less distressed. Okay, and then become aware of what, if you're going to find a clear winner. If you're not sure, you can just kind of take your best shot. Now, what you're going to do is starting at whatever foot that side's on, you're going to breathe up through the foot, through the leg, up to your solar plexus. kind of where you're breathing from, and then you're going to go down the other side, leg, the thigh, the leg, the foot, right? And then you're going to and then you're going to do it again. So you're going to do these circles where you start on one foot, and then the breath goes all the way to the other one, and you just go in that one direction. So breathe in, up to the solar plexus, breathe out, down to the opposite foot. You breathe in, up, breathe in, down. And now, when you're breathing up through the more relaxed or at ease side, imagine if the breath it's kind of sticky, and it grabs onto those more positive and at ease feelings, sensations, and it kind of drags them over to the other side. So breathe up, breathe out, down to the other foot. And breathe up and then down to the other foot. Now, take a pause and kind of ask yourself, how's that working for me? And it may not be working that well. Maybe it is. And in either case, I want you to experiment with trying the opposite direction. So whatever side you were breathing down through, switch the order and breathe up through that foot and leg and then down the other side. Pay attention to how that changes things sensation-wise and your sense of your body-wise. So yeah, breathe up to the foot and leg, up to the solar plexus, down to the other side. Up and then down. And just to be very aware of how it feels and what the differences are, if any. And if you don't like that direction, then switch back to the other direction instead. And typically what you're going to feel when you do this is a sense of ease in your body, more of a spontaneous ease in the body, rather than a rigidness or a stress sort of load on the system. Okay, so now we're going to prepare for the next exercise, which is a circle breathing, but this is going to be pelvis to face. So first, just kind of just be aware of your pelvic area, and when you breathe in, I want you to breathe up through your stomach and chest to your face. And when you breathe out, it's going to be down through your legs, and so arms and legs and out. So up from pelvis up to face, breathing out through the arms and hands, down through the legs and feet. And just kind of continue that kind of circular pendulation of breathing up, being aware of how everything feels, breathe down and out. And up again, and down and out. And all during this, you want to be aware of body sensations, even thoughts and feelings in response. Just be aware of them. It's no judgment, right? This is not a right or wrong exercise. It's just about being aware. So just a few more rounds of that. You're breathing up to your face, breathing out through your limbs, and out the feet and the hands as well. Okay. Our next circle breathing exercise is pelvis to tailbone. Now, this can be especially helpful for people that have back pain. That's not its only useful part of it, but it's especially helpful for back pain. So in this case, we're going to start from the pelvic area. You're going to breathe up to the crown of your head. Pause for a second. And then breathe down your spine and out your tailbone. So let's do that again. So up, breathe in, up to the crown. Breathing out, down the spine and out the tailbone. Up to the crown again. Breathe in, down and out to the tailbone. Just keep that up for a few more rounds. Breathe in and out. Breathe in, up to the crown and out through the tailbone. Do a few more, and then we'll go to the next. Okay, so our next exercise, this is circle breathing from hip to opposite shoulder and then back to the glutes. So you're going to let's start with our left hip. You're going to breathe in up to your right shoulder. And as you breathe out, you go from right shoulder to left hip. So in, up to the right shoulder, out, down to the left hip. Breathe in to left shoulder. Right shoulder, I'm sorry. Breathe in, excuse me, to right shoulder. And breathe out to left hip. So from left hip in the front, up to the right shoulder, and down the back to the other hip. And you can continue, on your own, you would do as many as you felt good. And now we're going to switch. So you're going to start with the right hip, and you're going to breathe up to the left shoulder and down to the back of the right hip. And you can do it even slowly if you like, whatever pace works for you. Nice, deep, slow breath, maybe count of 4. And then maybe on the way down, you're going to do maybe 6, a count of 6, something like that. From left hip from right hip to left shoulder and down back to right hip. Right hip to left shoulder and down to right hip. Do a couple more rounds. Okay. And then, so kind of drop in to be aware of where you are. If you found this content helpful, please like and subscribe. You can look forward to more videos about how to overcome chronic illness and chronic pain.